This is how you will be getting the suture material. Now you have to open up the suture material and you have to pull out the suture material from this. So once you take it out, you can see that the material is going back to the same position how it is kept inside the packet. But suppose this is silk. All the suture material will be kept inside the packet in a rolled manner. So suppose if you take the silk, it will be just hanging and it is not as same as how the proline will look like. So this property of the material to maintain its position when it was kept in the packet is known as the memory of the suture material. So proline is the one which is having high memory. Similarly, ethylene is also having quite a higher memory, but these materials like silk, vicryl, all these have poor memory. Okay, so that is one property of the material. So this is the So this is proline, blue in color, which is non-absorbable. This is again silk. Silk is black in color. See, this is black in color. Sister, light on the face. Both these are silk. You can appreciate the difference in the size of the needle. This is very large in size, so this is number 1. But this is smaller one, so this is probably a 20 or 301. And also have some, you can closely observe that how this needle looks like. So if you take a cross section of this needle like this, you can see it will be a triangle. The mold edge edge, so if you take a cut, you will get a rectangle, and the rectangle will have an apex which is basing upwards and base which is downwards. And this is known as the cutting needle. But in some needle you will have this apex which is facing downwards. So this, if you take the cut section, you will have an appearance like this. Some will have appearance like this. That is apex facing downwards. This is known as reverse cutting needle. So if you have apex which is facing upwards, that is a cutting needle. But when the apex is facing downwards, you will have reverse cutting needle. Reverse cutting and cutting needles are basically used to take suture material through very tough structures like palm, sole, rectus, all these things. Where you will take cutting and reverse cutting. Okay. So this is another proline which is smaller in size. So this is monocryl. Monocryl is usually colorless and it is absorbable in nature. And another thing, you again see closely, it will be looking like as if multiple small sutures are tied together. So such a kind of appearance is known as the braided appearance or polyfilamentous appearance. So silk is one of the classical example of a braided suture material. But whereas when you see proline, it's a single material, there is no tying of multiple suture material. So this is a monofilamentous suture material, whereas this is a polyfilamentous material. You have multiple filament which is attached together to form a polyfilamentous material, and this will form a monofilamentous material. So the importance of this is that, so you can see there are lots of small spaces inside this. So there is more chance for the bacteria to get added into these small spaces. So if you use a polyfilamentous material, there is more chance for infection, wound infection. So if you use polyfilamentous materials, you will have more chance of wound infection. So in a case of trauma, where there is more chance of infection, like arterial accidents, all this will be having increased chance of infection. So in such a scenario, you should never use a polyfilamentous suture material. You use either monofilamentous proline or ethylene. These are the usual common things which are being used. And another thing is vicryl. Vicryl boya. Vicryl color. Okay. So this was the silk that we have used. It is black in color. This is the vicryl. The betadine vechadonde. It looks like black. It will be more like this violet color. So V for vicryl for violet. P blue. So blue is for proline. You remember like this. So this is vicryl, which is again another polyfilamentous material. You can see multiple filament is there. So it is also looking like that of silk. But the difference is that braided silks are usually non-absorbable. there are some other silk which is directly made from silk worm. These are basically made from silk worm, and some of them are absorbable, but what we are getting nowadays is a non-absorbable suture material. But vicryl is something which is absorbable. Again, vicryl are of two types. There is a rapid vicryl and normal vicryl. Rapid vicryl is something which will get absorbed within 30 days. But this will take usually 90 days. So this is what we usually use. And this is again a absorbable polyfilamentous suture material which is violet in color, which will be usually absorbed within 90 days, and it is the vicryl. So vicryl is usually to close structures like for muscle, soft tissue, all these things. And this kind of proline, epsilon, 10, all these are used to close tough structures like rectus sheath. And this one, silk. Silk is used to, you can even use to do closure of deeper soft tissue structures, or as you have seen there, for fixing the drain, you can use. For the drain, abdominal drain, skin fix again you can use. Monocles are usually used for closing skin, for good cosmetic appearance, especially for inguinal hernia or all other hernia, thyroidectomy, breast lump excision. Following all those surgery, you can use this. Okay. So basically, we are absorbable suture material, non-absorbable suture material. Absorbable underൽ വരുന്ന കുറേ സാധനങ്ങൾ, vicryl, monocryl അങ്ങനെയുള്ള സാധനങ്ങൾ, cotton, linen ഇതൊക്കെ. Non-absorbable underൽ വരുന്ന സാധനങ്ങളാണ് silk, proline, ethylone മാതിരി സാധനങ്ങൾ. അത് ഒരു ടൈപ്പ് ഓഫ് ക്ലാസിഫിക്കേഷൻ. അബ്സോർബിലിറ്റി, നോൺ അബ്സോർബിലിറ്റി. അടുത്ത ടൈപ്പ് ഓഫ് ക്ലാസിഫിക്കേഷൻ മോണോഫിലമെന്റസ്, പോളിഫിലമെന്റസ്. മോണോഫിലമെന്റസിൻ്റെ അണ്ടറിൽ പ്രൊലീൻ വരും, 2 പ്രൊലീൻ ഉണ്ട്, പിന്നെ എത്തിലോൺ അതിവിടെ ഇല്ല, പിന്നെ മോണോക്രിൽ വരും. അപ്പോൾ ഈ എല്ലാ അബ്സോർബിളും എല്ലാം മോണോഫിലമെന്റസ് അങ്ങനെയൊന്നുമില്ല. പ്രോപ്പർട്ടി വിൽ വേരി. ദീസ് ആർ എക്സാമ്പിൾസ് ഫോർ മൾട്ടിഫിലമെന്റസ് ലൈക്ക് വൈക്രിൽ, സിൽക്ക്, ഓൾ ദീസ് തിങ്സ്. ഈ 2 പ്രോപ്പർട്ടി വെച്ചിട്ടുള്ള ക്ലാസിഫിക്കേഷൻ നിങ്ങൾ തൽക്കാലം പഠിച്ചാൽ മതി. ഇതാണ് ബേസിക് കോമൺ സൂച്ചർ. ദർ ആർ ലോട്ട് ഓഫ് സൂച്ചർ അതർ മെറ്റീരിയൽസ്. അറ്റ്ലീസ്റ്റ് യു ഷുഡ് ലേൺ ദിസ്. ദിസ് ഈസ് ദി മെഷ്. നേരത്തെ മാഡം കാണിച്ചെന്ന് തോന്നുന്നു അല്ലേ? അപ്പോൾ അതും പറയണ്ട. ഇനി ഇൻസ്ട്രുമെൻറ്റ്സിൽ